I'd like to welcome you to this webinar this evening. Thank you for taking the time to come and hear what we have to say here in terms of the Master of Public Health. Thanks, Paul. So I'm Shelley Lawler, and I'm the Acting Head of School for Public Health here at the University of Queensland. And like I said, thank you for joining us this evening and taking the time to learn more about our Masters of Public Health program. I guess one of the premises that I really like to start when doing this type of engagement work is that we have a mission in our school, and it's about working together to improve the health and well-being of populations in a changing and inequitable world. And when you join us here in the school, that is the journey you're part of. I would also like to acknowledge country, and I'd like to acknowledge the traditional owners and their custodianship of the lands on which we are meeting. I pay my respects to their ancestors and their descendants who continue cultural and spiritual connections to country, and recognise their valuable contributions to Australian and global society as our first healers, our first scientists, and our first educators. We're also committed to diversity and inclusion within our school, and we are explicit in this. There are diverse perspectives, abilities, experiences, and backgrounds which inspire creativity and actually really puts us on the pathway to innovation to enrich our communities. And this is all part of those foundations that we do in public health. So all people are valued and respected for their individuality, and we really strive to create a culturally safe, welcoming, and inclusive education space, workplace, where we really do have strong connections to our community and to the partners that we work with in the work we do in public health. So I'm actually going to hand over to Paul Gardiner, who is doing a phenomenal job as the Program Director for the Masters of Public Health. And I will hand over to you. So thank you, Paul.
Thanks, Shelley. Hi, everyone. Thanks for joining us. It's great to see so many of you online. So similar to the School of Public Health, which has a mission, our Master of Public Health has a mission as well. And we want our program to nurture and educate future public health leaders who can critically reflect, innovate, adapt, build relationships, and create change to improve the health and well-being of populations in a changing and inequitable world. So here you can see that we're actually trying to train the next generation of public health leaders. When we're talking about public health, what do we mean? Public health is the science and art of preventing disease, prolonging life, and promoting health through the organised efforts of society. So it's very much a multi-sectorial and an intersectorial collaboration of different organisations, governments, individuals, and community. And public health offers a rewarding career that can suit people from a variety of backgrounds. So you might have a background in health, science, education, and the social sciences. And we'll probably talk a little bit more about some of the backgrounds of our students later. When we think about public health, this is something that's been developed by the World Federations of Public Health Associations. And at the core, we're talking about protecting people from communicable disease. We're talking about preventing chronic disease, and we're actually talking about promoting health and well-being. So some of the functions of public health that we might think about are things like during COVID, controlling infectious disease through the wearing of masks and washing hands. We think about managing health emergencies, whether these are through natural disasters or other environmental risks. We also think about vaccination to reduce the likelihood of getting conditions like influenza or measles. I've talked a little bit about environmental hazards. Interestingly, at a conference I was at recently about the health of the region in the Asia Pacific region, they talked about the 3 C's, and they talked about the impacts of COVID, climate change, and conflict. And public health is really about addressing those 3 C's. Other things that public health is involved in is about promoting healthy behaviours. And this isn't just education, this is around policy and legislation and allowing people to have control over their health and to make healthy choices. And one of the ways we can do that is provide settings for health and well-being, such as healthy workplaces. Underpinning all of this are some functions. So we think about governance, and these are the structures and the laws that enable us to carry out these public health acts. So things like smoke-free workplaces. Advocacy is really important. There's a number of commercial determinants of health that we need to challenge, such as big tobacco. So we advocate for things like policy change, legislation. Capacity is very much about the workforce. And there's a lot of work going on at WHO, so the World Health Organization at the moment, about who is the public health workforce? What are the competencies that people will need to be part of the public health workforce? And we're right at the forefront of this work, involved with some of the agencies to help develop those competencies. And of course, all of our public health programs should be underpinned by strong evidence. And we also need really good surveillance systems to gather information to see if our public health initiatives are on track, if they're meeting their targets, if they're working. So UQ is ranked second in Australia for public health. And we're really strongly focused on preparing our graduates for the future. We offer 3 programs in public health. There's a graduate certificate, which is 6 months full-time or 1 semester. A graduate diploma in public health, which is offered for 1 year full-time. And then our flagship program is the Master of Public Health, which is available 2 years full-time. And you can start in the graduate certificate or the graduate diploma and articulate up to the Master of Public Health. In 2021, we actually had a review of our Master of Public Health program, and we listened, or we talked to a lot of our industry stakeholders, so organisations like Queensland Health, not-for-profit organisations, non-government organisations such as Cancer Council. And these are our key industry partners. And we asked them, what attributes and what competencies are you looking for when you employ public health graduates? We also spoke to our existing students and we spoke to graduates of the program. And then we spent a long time co-designing this new Master of Public Health. So this launched in 2023. So it's one of the newest programs in Australia, even though we've been offering a Master of Public Health for a number of years. It's accredited with an agency in Europe, and it's also accredited with the International Union of Health Promotion Education, which means that when you graduate, you are eligible to be accredited as a health promotion practitioner. As I said, it's a 2-year program, and we're really strong focus on that co-design of including key stakeholders who will be your future employers. We have a strong focus on employability skills, and this is not just in the final semester capstone courses. We try and emphasise those employability skills all throughout the program. And one way of doing this is the use of authentic assessments. So we're getting you to do things that you would when you're working in public health practice. So these might be things like writing an evaluation plan, writing an advocacy letter, some of those key things that you might be asked to do. We've also embedded the MPH with entrepreneurial education. So thinking about that creative solution to some wicked problems that we have in public health. And we do have those core work integrated learning or a research capstone at the end of the program. If you undertake the MPH, you'll gain the knowledge and confidence to influence and inform health policy. So that's whether you're working for government in a policy role or working as a policy officer in a different agency. You'll also be able to develop, implement and evaluate public health programs. So this is where you'd be looking at the need for a program and working your way all the way through to plan it and how would you evaluate it. And we really emphasize systems thinking and how do we understand and intervene on these complex health issues and wicked problems. We have a number of program level learning objectives. So our graduates will be able to demonstrate an in-depth understanding of the guiding principles and functions of public health according to key frameworks. This is a really important foundation for the rest of the program. So we really want you to get a good knowledge of some of the frameworks we use in public health. We also want you to be able to apply evidence-based, critical, reflective, and creative practice to address public health priorities. You may think back to earlier where I talked about public health being the art and science. So we really need to think about those creative solutions. And of course, everything is based on evidence, and we need to be able to critically appraise the evidence to see where the gaps are. But we also need to be reflective in our practice to see how can we do things better? What are the systems we're operating within? We want our graduates to be able to demonstrate cultural knowledges and ways of understanding required to enhance the health of First Nations people. We have a strong emphasis on embedding Indigenous knowledge into our program where we can. We want our graduates to be able to communicate skillfully with diverse audiences and stakeholders using a variety of methods and modalities. Our program is one of the few programs in Australia where qualitative research is one of the core courses. We value that really strongly, along with some of the other foundational elements, such as epidemiology and biostatistics. And communication is at the heart of public health. We work across a number of different sectors, not just in health, so we need to be able to bring all of those sectors together. We want you to be able to understand how to advocate for change related to core public health values. And these values are social justice, health equity, diversity, which Shelley mentioned earlier, and planetary health. And these are some of the key values that drive our program. And we really want our students and our graduates to be able to understand and demonstrate those values. And of course, we want our graduates to be able to work in multidisciplinary teams to protect and promote health and prevent disease in populations with complex local and global systems. And our program is structured in a way that by the end, you should be able to demonstrate all of these program level learning objectives. Now, we have 12 core courses. We have a number of electives, which I'll talk about on the next slide. And we also have a choice of 3 capstones. So typically, if you're doing full-time study and you enrolled in semester 2 this year, you would, in your first semester, be studying Foundations of Public Health, First Nations Health and Wellbeing, Health Promotion, and Preventing Disease through Healthy Environments. Again, our program is one of the few that actually has First Nations Health and Wellbeing embedded as one of the core courses. Then in your second block, or semester 1 next year, you'd be looking to do Introduction to Epidemiology, Introduction to Biostatistics, Fundamentals of Major Diseases, and Health Systems. And these first 2 blocks are really about giving you the foundational knowledge to set you up to address and think of creatively how to tackle some of those complex health problems. In your third block, you would be looking at, you would be taking qualitative research and also global health policy and practice. And here you could take some electives in this semester as well. And then in the final semester, you would be undertaking a capstone, and I'll talk more about those in a moment. And the two final courses, which are developing, implementing, and evaluating public health programs, and also research and evidence-based practice. So we're actually undergoing re-accreditation at the moment, and some of the feedback we're receiving is how great it is that our program is so comprehensive. We cover a lot of areas of public health, and probably more areas than most of the other programs around the country. We believe it's important for our graduates to actually get grounding and skills in these broad areas. And this is based on the feedback from our industry partners. So here you can see the 12 core courses that you would be required to take. And then in the middle, you can see that we have capstone courses. So we have a professional placement, which is a placement within industry for 2 days a week to work on public health programs. We also have a research project if you're looking to perhaps do some, go on to do a PhD. And then our newest offering in the capstone area is a public health impact lab. And I'm going to share some more information about that. Here is a selection of some of our electives, and we're reviewing our electives at the moment to see what areas we may need to add in some electives. But we covered things like extended knowledge in epidemiology and biostatistics. Our foundations of digital health and clinical informatics is really becoming more popular as digital health is being used more often. Global health is a real priority as well. We have some great programs in nutrition, or some great courses in nutrition. And then down the bottom here, we see some ones around cost effectiveness, communicable disease management, and One Health. So there's something that should hopefully appeal to all of you in those list of electives. We do have some flexible study options. So in 2023, our study or student cohort in the Master of Public Health, almost half of our students were international, and these would be students who would be internal students. So they come across to Brisbane to study face-to-face. Almost half of our cohort would be external. So this means that they would not attend the face-to-face classes. And about a third of our students are part-time. So if you're, thinking about, can I fit this into my busy work or family schedule? We have a lot of students who, are able to make it work. I talked about the full-time options, but there are some part-time options, and we can help students develop a personalised study plan as well. For those external students, a lot of the courses actually have some content online, so you can work through that material. And then the workshops that we have are really for more in-depth discussion and application of those skills that you've learnt about online. We do offer Zoom in the room for those who are able to attend, but we realise that, for a lot of external students, they'll be working or have other commitments. And so all of the face-to-face content, so those workshops, are recorded, and you can access that through our Blackboard system. Just going back to the Public Health Impact Lab. So this is our newest development for the capstone, and it's really designed to enable students to work as consultants on real-life projects identified by our industry or community partners. So far we've been looking at the health needs of women in prisons. We've also been looking at the health promotion offerings of UQ as part of the Health Promoting Universities Network. And there'll be new projects and consultancies coming on board as we engage with more industry partners. So we have teams of students who work in partnership with each other and the stakeholders to apply innovation and co-design solutions to pressing public health issues. And so this is an opportunity for students who aren't able to do placements to undertake a different type of capstone. And similar to both the other capstones, we actually embed a lot of employability skills in here. So you'd have sessions on, how to write a CV based on the program that you've studied. If you've done some reports, how can you actually put that into terminology around key selection criteria? And we've partnered with UQ Ventures to develop this. At UQ, we have a very strong student association. So this covers across both our undergrad and postgrad programs. And they organise a number of social activities as well as other career pathways events as well. So they're very active and are a great resource, and also a really great way to network with fellow students. I just wanted to quickly highlight some of the recent news stories coming out of the school. So we're a very active and strong research community. Many of the people who would be on this list would be teaching you in the Master of Public Health. And it's a real good demonstration of how research informs our teaching, and our teaching also informs our research. So you're getting access to some of the leading researchers internationally across a whole variety of areas. In terms of the applications, so you do need an approved degree in the same discipline. If you don't have that, you can also apply with relevant work experience. And there is also the option, as I mentioned earlier, to commence in the graduate certificate or the graduate diploma and articulate up. We do have 2 intakes each year. So in semester 1, you would need to apply before the 31st of January. And to start in semester 2, you would need to apply before the 30th of June. And applications are processed as they arrive. So it's always best to submit your application as soon as you can, just to make sure that it gets processed before the deadline. In terms of career possibilities, there are a number of different options. So we have graduates who are working in health promotion, in public health nutrition, in digital health, in epidemiology, in policy, in research, across a whole range of different content areas, but also working in a lot of different countries. So some of our international students will return back to their current country of origin. Some of our students from Australia will go and work overseas. We have one at the moment who's just started working in London. Some of the roles of our past students include policy officers, research assistants. We do have a number of students who go on to develop, to undertake PhDs. Some of them become lecturers, and we also have, people working in health, safety, and the environment. In terms of the major industries, we can see here that, there are a range of different industries where our graduates are employed. And start, from media and communication through program and project management, business development, community and social services is a big sector, research and education, obviously, and most of our graduates would end up in working in healthcare services. And our graduates are working all over the world. So thanks for listening to that presentation. We've got some time for questions now. Just looking at the question in the Q&A, we have, is there a list of approved degrees? I'm graduating from a Bachelor's Social Science majoring in Health and Society. Is this an approved degree? So Social Science is an approved degree, and there is more guidance on our website. And Lachlan, perhaps you could put that in. I'm not sure if you can list that on the chat or not.
Yep, I can do that.
I might stop sharing so that people can see this. Thanks for the question. So the question is around, is there any assistance provided for job placements? If you're talking about the capstone for the professional placement, we do help students with that. Students can also approach industry partners that they may have a relationship with. So, for example, at the moment, we have students in placements with the Institute for Urban Indigenous Health. We have some students on placement with a public health unit, with some consultancy groups, you know, the Lung Foundation. So for those, for that placement capstone, we can certainly help students, but we also are aware that some students may have particular preferences, and we can work with the student to identify and meet those needs. There's a question about, is research compulsory in the master program? So we have some research courses that you would need to undertake. These are research and evidence-based practice is one of the courses. And then the other course is the qualitative research course. And these are key elements to helping address some of the competencies that our industry stakeholders said they wanted in graduates. So you don't undertake the research as such, but you are able to understand the research and have a good understanding of the research methods. So you'd also be undertaking biostatistics and epidemiology. If you're interested in doing more research, you can do a research project as a capstone. And this is where you would work with one of the researchers at UQ or externally to conduct a research project over the course of one semester. Victoria's asking about, I've done some MPH courses before, where can I get some help to apply for credit? So Lachlan, is this something that you can answer?
Yeah, I can shed a bit of light there, Victoria. So if you've done particularly Master of Public Health courses in the past and the content does align, so basically same level, same content is a good rule of thumb, you're welcome to apply for credit. You can do so after you have been approved for the program at UQ, after your applications come back successful, because you do need a student account to go through the application process for credit. You can also, though, in the meantime, we do have a UQ credit precedent database, which is open. Everyone can see that online. And so you can see perhaps if someone has applied to get credit for the same subjects that you're looking at doing in the past and where they've gotten that credit from. And there may be even someone who's come from the same institution as yourself and has applied for that credit successfully, which would give you a good indication that you'll be successful when you do go to apply yourself.
The next question is opportunities to work as a research or teaching assistant during the course. Certainly some of our MPH students work as research assistants. A lot of our active researchers would have ongoing projects which might require some additional assistance. So that's always an option. And, you know, there might be opportunities as well for some of our MPH students to tutor at the undergrad level. In terms of the difference between the master degree and the graduate certificate, so the graduate certificate is 4 courses, and the Master of Public Health is 16 courses. So it's designed as a you know, a smaller version of the MPH, if you like. Certainly there are a number of students who would start with a graduate certificate, and it's often a good idea, you know, for people who are working to get a taste for study. And a lot of those people who do complete the graduate certificate would then enter into the Master of Public Health. So you're not disadvantaged by starting with the graduate certificate. Lachlan, do you want to answer that?
Yeah, I can take that one. So the question is there a minimum band of bachelor degree or GPA cutoff for the program? The cutoff at the moment is a 4 on our scale of 7, so that's equivalent essentially to a pass. So you've got to have a passing average across your previous studies, and that's all that is required in terms of GPA. Obviously, you have to meet all of the entry requirements, though, not just the GPA.
Yes. So if you start with the graduate certificate, you don't have to do those courses again when you do the masters. So if you complete 4 courses for the graduate certificate, that means that you have 12 to do for the Master of Public Health. And Lachlan, I'll let you take the next one.
So the question is, if you're already a UQ student, do you apply through QTAC? You do not. In fact, no one applies through QTAC for this. So all applications are directly to the university, both for UQ students and for new students to the university. It's a really easy website to remember. It's just apply.uq.edu.au. And you actually, will be able to access that for free rather than going through an admissions centre where you might have to pay a fee. Of course, that does mean you can only apply for UQ programs through that portal. So you'll find that most universities for their postgraduate coursework will have that same sort of setup. We're just applying directly for free with that particular university.
Lachlan, I'll let you answer the first part of that question, then I can tackle the bit about the electives.
Great question, Ibrahim. So you won't be able to directly transfer your admission to Adelaide to the University of Queensland. So you do still have to apply to UQ. Now, I would hazard to guess, having spoken to my colleague in Adelaide last week, that the entry requirements are more or less the same between the two. So I'd very much encourage you to do that as soon as possible. But no, we can't just take that application and automatically assess it for ourselves. We'll need to have an individual submission from you.
One thing I will add about that, Ibrahim, is that the University of Adelaide and the University of South Australia are merging, and that starts in 1st of January 2026. So there's a lot happening in that space in Adelaide. We do have a number of clinicians, dentists, vets, nurses, and other people working in oral health who undertake our MPH. We also have people working in the Defence Force. And if you're working in the Defence Force, you can apply for a student access plan, which allows you to have some flexibility around study. So that's you know, for people who have health requirements, but also for people in Defence Force or elite athletes. So we offer a bit of flexibility around that. So we don't have any particular electives related to oral health, but there is the opportunity to get electives from other areas approved by myself and the Associate Dean academic. So we could chat about that if you do the program. So in terms of, we've got a question around from Amisha around the capstones. So most of our courses are 2 units, which is we say would be about 10 hours a week, including the face-to-face contact, any material that you would do online, as well as your assessments. The capstones are really at the end of the program, and they're a way for you to demonstrate a lot of the skills and knowledge that you've acquired throughout the program. So it's a way also that we can embed some more of that employability. So the capstones are around those very strong work integrated learning experiences. So the professional placement or the public health impact lab, or the other option is that you can do a research project. So they're really a way for you to demonstrate that you've what you've been able to learn and get you ready for the workforce. So there's a question around, Lachlan, do you want to answer that one?
Yeah, I just double checked, and I'm almost certain that would be a master's admission there. But
yeah, that would definitely be a master level admission.
Got to toe the line and say, please put an application in so we can make an official assessment.
Yeah. So this was around a diagnostic radiography degree with 16 years work experience. And certainly we've got someone in the program at the moment who has a similar background, not quite as much as experience, but yeah, very much a similar background. So in terms of how many hours per week for full-time study, Lachlan, did you want to answer that one, or do you want me to?
I can go the general UQ answer, and then if you want to add anything specific to the MPH, I can give that as well, or you can give that. So generally speaking, most postgraduate programs, it's at least 2 hours of coursework per subject, could be 3 or 4 depending on the commitments with tutorials or seminars and that kind of those other sessions. Now there is a suggestion that per course that you are in, you might want to look at 8 to 10 hours of study on your own. That's the quoted statistic, but it varies widely by individual student, as well as your schedule and how you're going with the content. So it will end up being very much up to you. But that's why they call it full-time study, is if you're studying full-time, you end up approximately with the same number of hours of study in a week as someone who is working full-time would spend at work. Yeah. So it is quite a bit when you're full-time.
Yeah, and I'll just add that it can ebb and flow a little over the semester. So the semester is 13 weeks, and we do have 1 week gap in the middle. It very much depends on the individual. So that would be around your previous education, what sort of work experience you have, but also, sometimes the passion for the particular course. You might be more interested and you might want to do a bit more. So we're doing some work this semester to actually try and get a handle on how much or how many hours students are spending. But anecdotally, the students say that it's not too much. So there's a question about, I'm a dentist who has completed a postgraduate diploma in management and interested in pursuing the MPH. I'd say there's a very, very, very strong chance that you would be accepted by UQ. I don't know if I can say it any stronger than that.
Yeah, I think that's about it, given the dentistry background. Yeah, certainly.
Yeah. So the master program is offered both externally and internally. So as I said, probably close to half of our students would be external. The difference is that students who are internal would attend the weekly workshops or classes in person, and those external students could join via Zoom in the room, or they can look at the recordings of those sessions in their own time.
That's the bottom of the questions. Well done, Paul.
No, there were some great questions in there.
Hello there. I do have a couple of other questions,
Okay.
if you don't mind.
Yeah.
So these ones might be appropriate for you, Lachlan, or Paul, by all means. So we've had a question here. Can students access career guidance or support at UQ?
Yep, absolutely. So I'll go the general line, and then Paul, if you want to add anything, go for it. But all students, internally or externally, have access to the career guidance and our careers and employability team centrally at the university. So that ranges from everything from going to sort of group workshops and reading the material that they put out, through to offering actual one-to-one advice where required. And you can book that in online as well if you're a student who's perhaps studying externally and isn't actually in Brisbane.
And, in terms of public health, we, work with employability to customize some of those experiences for public health, and they're offered through our capstone courses. We've got a question about, if enrolling externally, are we able to attend in person the workshops and lectures sporadically as an option? That's fine. Yeah, we're happy for external students to turn up when they can.
I have another more technical question. So do students need to apply separately or again to get their Commonwealth supported place?
No, they don't. So all the places in the MPH for domestic students, I should clarify too, are Commonwealth supported, and the domestic students will not need to submit a second or application or any further sort of paperwork to receive that. It's allocated automatically upon your acceptance of your offer in the program, and then your student account and everything will reflect that as you go forward.
I'll add one more to the mix here.
Okay.
So you did speak about this, Paul, in terms of the undergraduate degree versus the work experience. But we've had a question. I didn't study science as my undergraduate degree. Can I still study public health?
Yeah, for sure. So what generally happens is there is a list of, approved areas of study on the website that Lachlan's put into the chat. If you don't see something there that you've done, by all means, put in your application. We may ask for further information. So sometimes we ask for a CV to look at work experience. And each of those cases is assessed on an individual basis as well. Lachlan, do you have anything further?
No, that's basically it. Yeah, is definitely still give it a go, particularly if you've got that work experience, and that's where the list comes from. It's people that have applied over the years. There might be things added to it as time goes on.
Exactly. Just following up from that, Miller, I'll just add that, there are some of our students who will come directly from an undergraduate program. So they may have done the Bachelor of Health Sciences at UQ, or, a bachelor program elsewhere. But we also do have, a number of students who are in the workforce who, are looking to change careers, or they're also looking to get, qualifications in public health. They might be working in public health already, but don't have an MPH. So we have a really broad range of students. And one of the things I always say in my first lecture for the semester is that, I'm going to learn as much from the students as they learn from me. So, they bring a wide range of experiences, both professionally and culturally. And, I'm always learning from the students.
I think that sounds like a really nice place to end if there's no further Q&A, actually. Oh, here we go. English language requirements. I can get that one, actually. Thanks. That is a very good question. So I will say, always confirm through our actual English language requirements webpage online. But this program, I believe, has our standard set of English language requirements. And there's a really good explanation of those, because there's a variety of different ways you could meet those online. But generally speaking, it's through an IELTS test or perhaps through work experience or other study that you've completed in Australia. So I direct you for the details onto the website. And then if prior qualifications were obtained overseas, are course transcripts required on application? The grades are to calculate the GPA. So yes, your transcript is required. Then if you are perhaps dealing with an institution that it's difficult to retrieve documents from, I would suggest getting in touch with our admissions staff in the first instance. Most places are happy to reissue you transcripts for free or at a very minimal cost. And then the only other thing to consider is if your transcript and your award are not currently in English, they'll need to be officially translated so that we can have an English copy of those that's certified.
And sometimes what we do is, you know, if there's any doubt about whether the degree is relevant as one of those, you know, background areas, we actually walk through the list of courses that you've studied in your previous degrees to see whether you meet the needs or meet the requirements. So lectures run Monday to Friday. We try and timetable them so that you're on campus 2 or 3 days a week. And generally each course would have a 2 to 3 hour workshop every week or two. So generally they'd have 8 to 13 of those workshops throughout the semester.
It seems as though that's it. It's always a waiting game. Would you mind, Paul, actually just sharing the contact slide that you had at the end there? Maybe that might be useful for people before they sign off, just to see that one.
I hope. That one?
Yes, that's the one.
Okay.
Just to make sure people have one more opportunity to grab that. And that email and phone number works for both domestic and international students, I can confirm as well. Oh, one more question.
Lachlan, do you know the minimum number?
Minimum, so this program and most postgrad programs at UQ, the minimum is 2 units if you're to enroll, if you're actually to enroll. In most cases, you can also, if you need to take interruptions throughout, you can. With a you know, the polite thing to do would be to let your school know that you're doing it, but 2 would be the minimum, which is 1 course, 1 subject at UQ. But obviously then, you know, you're going to lengthen your program in relation to your study load.
Yeah. And in terms of an academic advisor, that would be me. So I'm, you know, happy to meet with students to work out study pathways for them. And I do that quite regularly.
Righto. I think some people are starting to trickle out and it's just gone 10-2. So that might be the famous last words. The 3rd time I've said that now. Yeah, thank you very much for coming along tonight, Paul, and thank you everyone for attending.
Thanks, everyone. Hopefully